we thought we'd arrange it just to hopefully spread a bit of awareness about our services. We do sort of lots of these presentations and stuff, and lots of questions come up, lots of good discussions. So we thought it'd be good to get everyone together, have some time to discuss different points, to talk about our services, go into a bit more detail, and hopefully at the end of it give you a bit more awareness of what we do, but also to discuss some of the sort of wider issues around it, particularly around obesity, safeguarding, and some other bits that we'll go into. So to introduce myself, I'm Matt Stevens. I'm the Healthy Lifestyles Manager for Children's at OneLife Suffolk. I'm also joined by my colleague Sarah.
Morning everybody, I'm Sarah Andrews. I'm the specialist nurse in our Tier 3 team at OneLife Suffolk, and I'll be presenting a bit later more about my work within the Tier 3 team.
Thanks, Sarah.
And we've also got Faye Bentley here. Faye, do you want to introduce yourself?
Morning everyone, my name's Faye Bentley. I'm the Strategic Children's Service Manager, and also I've been the dietitian for the service as well.
Thanks, Faye. We are going to be recording today. It looks like someone has already started the recording. I assume that's you, Tracy. So thanks for starting up.
Yeah, is that okay? I've started it. So yeah.
No, I'm glad you have, because we were trying it earlier and there were a few technical difficulties. So that's good. So just to give you a run through as to what we'll be going through. So I'll do a short presentation on basically what we offer, our services, how to refer into our services, and bits around that. Sarah will then go into a bit more detail around what we offer, what our sort of position is as a service, and talking about some case studies as well. So some examples of some of the clients that we've worked with. And then we'll also, I believe, have a presentation from Rachel Furley, who will be talking about obesity as a safeguarding issue. We'll then allocate a nice chunk of time at the end for lots of questions. So if you can keep hold of your questions till the end, feel free to put them in the chat if you want, just to make a note of them. But we thought it'd be best just to collate those at the end, and then we can go through all those. So yeah, we will crack on. I'll share my screen, so hopefully everyone will be able to see my presentation. Right, so go. So OneLife Suffolk, so we're commissioned by Public Health through Suffolk County Council to offer healthy lifestyle services to residents of Suffolk. So OneLife Suffolk, we're a subsidiary company of More Life UK. We also work closely with Leeds Beckett University. All of our programmes and curriculum are evidence-based, and we work with the staff and professors at Leeds Beckett University to produce that curriculum to ensure it's all current and evidence-based, and that is monitored by our clinical team as well. Our services follow a community-based approach, so we look to get out into the communities of Suffolk. We sort of base ourselves in the three main areas, being west, more central and eastern, and then up in Waveney as well. The services also constantly getting sort of evaluated and researched by Leeds Beckett University to ensure our best practice is delivered, but also for sort of for future as well, to ensure that what we're offering is effective. So OneLife offers a number of different healthy lifestyle interventions for residents of Suffolk. We offer adult services around weight management. We also offer things such as health walks, help to get active for adults as well. We also offer free health checks to people aged 40 to 74 years. We have a stop smoking service as well for teenagers and adults. And then, of course, we have our families and young people service, which is what we deliver. So our families and young people service, we offer family programs to families within Suffolk. Each of our programs offer a full 12 months of support, but we offer a tiered approach with different levels of support at each tier. We look for a whole family approach, knowing that obesity and healthy lifestyles sort of come from the parents, and obviously getting the whole family on board is very important for us to ensure that the support is effective. As part of our community programs, we offer physical activity and healthy lifestyle sessions. Each week we cover different topics around a healthy lifestyle, and that also includes a physical activity session to ensure that the families are being active. After an intensive phase of the programme within our Tier 2 and Tier 3 services, we also offer maintenance support for 12 months to ensure that what we've sort of gone through within the intensive phase is then sort of followed up and kept up as such, and to hopefully encourage the families to sort of bring in these habits and to keep them up over an extended period of time. We are a small team, so we do cover the whole of Suffolk, and our practitioners travel across Suffolk to deliver in different venues, community venues across the county. We do also offer Zoom sessions occasionally, but we do find obviously that engagement is a lot better if we can do it face to face. So I spoke about a tiered approach. We have Tier 1 interventions with families. That is sort of our basic level, and that might include just conversations with families. We will quite often go to events and just have quick conversations with families around, you know, how are they getting on with supporting their children, with healthy lifestyles, things around diet and exercise, that sort of thing. So those quick conversations, those small interventions, we would class as like a Tier 1 intervention. There's also things we've done in the past around after school clubs. We also offer free webinars on our website as well, around cookery and other sort of healthy lifestyle tips. Our Tier 2 service is a high level of support, so it is a initial 10-week program, 10 weekly sessions that cover different healthy lifestyle topics such as sleep, exercise, diet, and lots of other topics. As I touched on, after that first 10 weeks, we then have sort of staggered sessions over the next 12 months, which work as maintenance sessions. In those sessions, we would go sort of into sort of a bit more detail with the parents around their progress on the programme, recapping some of the topics that we went over previously, and just offering that support to ensure that they can keep up those healthy lifestyle changes that they've made. Our Tier 3 service is a more specialised level of service. So again, it does cover 12 months, but it's a more intensive level of support. And that is for children and families that may require additional support. That may be those with longer term health conditions, maybe children and families that have got complex social, physical or emotional needs as well. So we will, I'll go into a bit more detail, but we obviously discuss that at the sort of triage stage. And if we find that within their support, they do need a more specialised approach, then they will go into our Tier 3 service. So just going into a bit more detail about our Tier 2 programme. As I say, they're weekly sessions for 10 weeks, and then they go into more infrequent sessions across a 12-month period. The sessions are initially available to children living within Suffolk between the ages of 5 to 18, and they must be considered above the healthy weight range, which we measure by BMI, and they must be above the 91st centile within or on the child growth chart. We encourage the whole family to attend, so parents are required to attend, parents or carers. We also offer the sessions out to siblings, even if the sibling doesn't meet the eligibility criteria of BMI. We understand that for a child to have this sort of lifestyle intervention be effective, the whole family needs to get on board, and it's the parents and siblings being able to support the child, which can really make the difference. So yeah, we offer that support out to the whole family. Our practitioners are trained to deliver our healthy lifestyle content, and we have physical activity leaders to lead fun and engaging physical activity sessions. As I say, the curriculum is backed by Leeds Beckett University, so it does evolve our curriculum based on their sort of current studies and evidence, but it covers the sort of basic healthy lifestyle areas, as I say, such as sleep, energy balance, food intake, physical activity, basic sort of topic areas that maybe parents need a bit more sort of guidance on. But our sessions, we try to make as interactive as possible, and we, rather than make it into sort of a lecturing approach, we try to have open conversations, and basically our practitioners are trained to facilitate an open conversation with parents to make them feel as though they're the ones empowered to make those changes. As I say, different topics also cover things such as sugar and drinks, food labels, and portion sizes. So within our Tier 2 services, we also work closely with schools. So we now deliver 6 weekly sessions or 6-week programs within schools, which cover similar content to the 10-week Tier 2 programs. We deliver them to full classrooms. There's no sort of eligibility criteria as such, and we normally sort of bolt it onto the RSHE programs that or curriculum that schools are currently delivering. We do target schools within more deprived areas of Suffolk, based on the evidence that obesity prevalence is heavily linked to levels of deprivation. So we do target those schools in those areas. We also work closely with schools around NCMP, National Child Measurement Programme. So we are sent the data from those measurements that are taken around Suffolk. Our practitioners then get in contact with families that have where the child has been measured and been indicated that they're at an unhealthy weight. We'll call those families directly. Our practitioners have been given training around those sort of sensitive conversations. Sarah will go into a bit more detail around how we deal with those, but as you can imagine, they can be quite sensitive, and parents can react negatively. They can be upset. They can sometimes take it as sort of accusatory. So there is a lot of work we're doing around that to try and improve the effectiveness of that. But that is a big way for us to gain referrals into our program, and we hope that most families see it as a positive, that we sort of contact them and we're offering that healthy lifestyle support. And it's offering it at an early stage to children, hopefully, so that when they're growing up and becoming an adult, they're already bringing in these healthy lifestyle behaviours, and we're already offering that support. So our Tier 3 program, our Tier 3 service is slightly different in that it is a pilot program and funded slightly differently. Within our Tier 2, we're funded by Public Health. Tier 3, we're funded by the Integrated Care Board, by the NHS. The Tier 3 program, or Tier 3 service, offers a more intensive level of support, and it's made up of a multidisciplinary team of a specialist nurse, which is Sarah. We have a dietitian, a family therapist and counsellor, a physical activity coordinator, alongside our Tier 3 practitioners. We are commissioned to deliver these programs to families on a group basis, but we also offer one-to-one support. Through their triage into our programs, we will identify families that may require that one-to-one support. Quite often it will be, for clients that maybe aren't able to get to a group, or it may be inappropriate for them to be in a group setting. But we will discuss that with the family and with the professionals involved with that family at the triage stage. We can also deliver one-to-one specialist support as well. So our MDT will discuss clients as they come onto the program, and identify any families that may require that specialist support. For example, a family requiring specialist support around their diet, we may refer on to our dietitian, who can then arrange to see them in one-to-one sessions as an additional sort of bolt-on service to our standard Tier 3 service, where they learn they go through the curriculum of healthy lifestyle behaviours. So that additional support comes as in addition to that base program. As I say, the initial triage will identify a lot of these clients that need that additional support, but also they may be identified as needing that throughout our program as well. Our MDT meet on a bi-weekly basis, and we'll discuss these clients and identify anyone that may need that extra support. The sessions are for 12 weeks in comparison to our Tier 2 program, which is for 10 weeks. That just being because we go into a bit more depth in Tier 3 around healthy lifestyles, things around sort of the psychological things behind healthy lifestyle behaviours as well. After the 12 weeks, similar to Tier 2, we continue that support for 12 months across regular maintenance sessions, which tend to be monthly for a while, and then they go sort of every few months up until that 12-month session. As I say, the curriculum does progress a bit from tier 2. A lot of it is covered in tier 2, but obviously a lot of the families that we work with within tier 3 may require to go into a bit more detail on certain topics. So eligibility criteria, I touched on for tier 2 that they need to be living within Suffolk between the ages of 5 to 18 and their BMI above the 91st centile. It's the same for tier 3, but we also for tier 3 the client will either have potentially emotional and behavioural issues, so we work with lots of children with autism, but they may also have sort of learning disabilities and Prader-Willi syndrome. We will work with clients as well. We work with children on safeguarding plans, so children that are currently working with other professionals, we will work closely with those professionals such as social workers and GPs working with the family to offer our program as well. We do also, excuse me, we do also offer our tier 3 service to children that may have previously accessed a tier 2 service. We do find sometimes children going through our tier 2 program that maybe they haven't engaged to the level that they need to, they haven't been able to adopt those healthy lifestyle behaviours, so we will then potentially move them on to tier 3, where they'll receive a bit more of a specialised support, and hopefully then that would be more effective for them. So I've just displayed a bit of a pathway for our tier 3 clients. Obviously, as professionals, as yourselves working with children, our tier 3 service may be the service that more the clients that you're working with will be referred into. I'll go through the referral process shortly, but they can be referred in by yourselves as professionals into our tier 3 service. If they do self-refer, if a parent does try to refer in, but they're more suitable for tier 3, we will then contact the GP just to receive an official referral from them. They go for a triage initially with our client services team, who do an initial assessment. They go through some questions to learn more about the family, which then helps them to work out if they possibly are more suitable for tier 3 rather than tier 2. If they are suitable for tier 3, they then go on to Sarah, our specialist nurse, who then completes a clinical triage, and we'll go into a bit more detail around their situation. At that point, and this is something that Sarah will go into a bit more detail, but Sarah might actually identify that the family isn't actually at a stage to receive our support. Bear in mind their circumstances, support they've received in the past. It may be that actually it's not really suitable for them to go onto our program just yet, but maybe later down the line it might be. It should also discuss a possible need for one-to-one support, whether that's from our specialists or whether the actual program needs to be delivered on one-to-one support as well. Once they're booked onto our program, we will then continually assess their needs. Within our program, they are weighed and height measured weekly, and we do track their progress in terms of weight, but we also track it in terms of their healthy lifestyle goals. So we measure them through questionnaires. We will complete questionnaires around well-being and also around physical activity. So it's not all about weight, and we do try to make that clear within our program that we're trying to encourage healthy lifestyle behaviours, and a healthy weight is a byproduct of that rather than it being focused on their weight and BMI. Obviously that is the eligibility criteria for them to get into the program, but really we try not to mention that around families. It's much more around the behaviours that they're doing. So yeah, once on a program, they'll be continually assessed. They'll get through to the end of our program in a maintenance phase. It might be discussed at that point that they need further support, and then at that stage we'll then discuss potentially re-enrolling them onto the program again, or we work closely with external providers that may be able to provide additional, possibly more clinical support in some cases, but yeah, we'll discuss that at that stage. So when it comes to referral, we receive referrals from lots of different sources. Parents can self-refer into our program for tier 2. As I say, if they do self-refer but are suitable for tier 3 support, we will then go back to the GP to receive a referral from them and confirmation. School nursing teams we receive referrals from, and that is historically has been sort of a big source for us of referrals. As I touched on, the NCMP programme, so our practitioners will contact children that have been measured by the school nursing teams. We do call those that are above a certain centile of BMI, but we will also write to families as well, offering our support. GPs, so we'll receive referrals from GPs. It's some work we're doing at the moment just to try and engage a bit more with GPs and make them a bit more aware of our services, but also trying to simplify that referral process. And hopefully now we've got quite a simple referral process where GPs and other professionals can feel comfortable, feel confident, and hopefully it's an efficient process to refer into us. Other health professionals we may receive referrals from, including midwives, health visitors, etc. We may receive referrals from. We are more than happy for professionals to contact us, and you don't necessarily have to make an official referral straight away. We'll give our contact details at the end, and we're more than happy for you to contact us just to discuss a client that you may be working with, to see if our programme may be suitable for them. Social care, also another a big source of referrals through social workers in particular. And then through outreach and community events, we'll try and have those conversations with parents and to offer our services to them. So the referral process, the best way to refer is through our online form. The link is here, and we'll send that link out at the end. It can be done over the phone as well, so you can speak to our client services team who will complete that over the phone assessment with you as well. But yeah, simple enough form to fill in. We just ask for basic details, including their BMI at that stage. Once that referral has been submitted, we will then go back to the family to complete the sort of next stage of it to get them booked onto a programme. As a professional referring in, you'll always be kept up to date by us as to the client's progress, but also that initial stage of ensuring you're made aware once they're booked on and what's been decided with the client, just so you can then continue to offer the support that you're already offering, obviously. And our team of will keep in contact via letter, via phone, to ensure you're kept up to date. When you refer into our service, there's no need for you to necessarily decide whether a client needs a tier 2 or tier 3 level of intervention. That is, that's down for our charge team, for Sarah and our other professionals to have that discussion with the family. They may have that discussion with you as well to find out a bit more, but really we will then decide at that point what is more suitable for that child. So yeah, you don't necessarily need to decide that at the point of referral. For you, if you can just refer them into us, we can then do that assessment ourselves. So yeah, we openly encourage referrals. We do, we do need to increase the numbers referred into our services. And it's a free program. It's really positive, we hope, and as much as it can be difficult to sort of try and communicate that out to parents, the families we do work with do find our services really popular, really positive, and in general they've had a really good effect on lots of people's lives. So our job is just to sort of try and spread that awareness and make it as simple as possible for people to refer into our services. Okay, so that's my bit done. Sarah, I'll hand over to you. I'll just try and give you control of my screen.
Lovely, thank you.
There you go. Hopefully you should now have control.
I can't see the presentation. Have you got the presentation up still?
I will. Yeah.
Yeah, lovely.
Cool.
Can everybody hear me? Perfect. So as I mentioned at the start, I'm Sarah. I'm the nurse in our team, and I'm just going to go through a few slides here talking about some of the clients that we work with. So as we go through this, I think it might be helpful for each of you maybe to have in mind a child that you might well have referred into us, a child that you might be thinking about referring to us, or a family that you may have worked with, maybe thinking of some of the challenges you might have already faced with them, or any of the things that you might think that might really help those families. And as Matt said at the start, at the end, we're going to have an opportunity to have some of those discussions between us as professionals to see just how we can improve that support for families. So yeah, just get your thinking caps on of a family that you might have some questions about at the end. So as we mentioned earlier, in our Tier 3 service, we work with a lot of families that are often on child protection or child in need plans. Sometimes children will come onto one of those plans purely because of the weight of the child, and we work closely with social workers, family support practitioners, other professionals working with the family, often paediatricians if they're involved as well. So as Matt said, when you make that referral in, it is quite a simple form, but there is a section to put further details in, and it's really helpful if we have the contact details, the names, the email addresses for any other professionals working with the family. We don't have access to System 1, we can't access other medical records for the child. And we have had children on our programme that it's come out, they've joined our programme and it's come out down the line that maybe other professionals are involved that we haven't been made aware of. And it just really helps if we're all working together around the child. So that can be really helpful if those details are shared with us as soon as possible. And for some families, it might not be that we need to be involved in every core group meeting, child protection meeting around that child if that's not the main reason that they're on that safeguarding plan, but just that awareness and that communication is really helpful around that family. If families don't wish to engage in our programme, or if they don't attend, if they've been referred in, we will update whoever referred in. So if you receive an email or a letter or a telephone call just to update, then and just also being aware that families do need consent to that referral in, and we have had situations where we've contacted families and they've not been made aware or not quite understood that referral has been made for them. So just having those conversations right from the start about why perhaps you're suggesting that referral, that you are making that referral, and also so that to expect a call from us. As Matthew mentioned, that there is that process when the initial referral comes in, client services contact the family, and we do have issues often with trying to get hold of family members. Telephone numbers change, we don't get through to people, we leave messages. So just again, when you get that consent to make that referral, making sure that we have the best contact number to contact the family on is really important. We have had clients not progress to service purely because we cannot get hold of the family if we've got no other way to contact them, and that can just be really frustrating. As Matthew mentioned, we deliver that whole year approach, so sometimes families can miss out joining at the start of a new cohort, so we start new groups around every 3 to 4 months depending on which programme they're on. So if they miss the start of that because we're just not able to get hold of the family, that can be frustrating. So yeah, just giving us those details would be brilliant. So there we go. So as Matt mentioned, we do try and deliver our programme within a group setting. We find that works really well for most families because the children get an opportunity to meet with other children that are in a similar situation to them. The parents feel really supported because they're able to have those conversations with other parents, and so when we deliver our programme, we do 45 minutes all together with the children and the parents all involved. That'll often involve some practical things like when we cover portion size, we'll be getting cereal out and measuring it using our hands. We'll be doing lots of activities. We have life-size body maps on the floor that we use to deliver different programmes about healthy lifestyles. Lots of interactive games that the children can get involved with. But later on in the session, while the children are in the sports hall or in the nice summer, we've been outside at some of our sessions out on the playing fields. We have opportunity to sit down with the parents or the carers or whoever's brought the child along, and we go into much more depth with the parents, so they're able to support one another, and we can offer more in-depth discussion around some of their concerns, some of the barriers and issues that they face. As we did mention, though, we do have the opportunity to deliver one-to-one support if that's more suitable, but we are, as Matt said, we are a very small team, so we have to discuss that on a case-by-case situation. So I think Matt's mentioned all about how the session runs. So with the physical activity, we have children on our Tier 3 programme that have disabilities, that have limitations to their physical activity. So we will always adapt what we deliver. There's not a one size fits all. Often our physical activity coordinator will get the group together at the start of running a new group, talk with the children about what they enjoy doing, what they'd like to do, what sports they're able to do, and we can offer additional support. So if children have disabilities or are unable to join in certain games, then we can adapt what we deliver. And as Matt mentioned, when it comes to the physical activity, we can offer additional one-to-one support outside of the group setting. So give children ideas, create exercise programs, particularly based around those that have limited in the way that they can join in exercise, give suggestions and signpost to what services are available in their area. So throughout the programme, we work through smart goal setting. So while we deliver the programme to all the families together, the children all have a handbook, and each week, whichever topic we cover, we will encourage the family to sit down together and set a SMART goal. So set a goal specific to them, something that's achievable, making those small lifestyle changes that are sustainable. As Matt said, we don't want them to come on our programme. We have children that do come on our programme for a year and then need further support, and that's absolutely fine. But what we love to see is when families are able to make those changes themselves in a way that then at the end of the 12 months, they can go on and sustain those changes. So we're not a quick fix, quick weight loss service. It's making those sustainable lifestyle changes as a whole family. So we also send out additional resources to families, either sending them home with things to do or sending out emailing additional resources during the week, covering the topics that we've done that week. And as I mentioned about the one-to-one delivery, we will discuss that at the MDT meeting if we need to offer that additional support or if it's more appropriate. And when families come on board on our programme, we're constantly in communication with them. We always say, look, if this isn't working, let us know if we can make any changes. I'll often, so as part of my triage role, quite a lot of families, I'll go and visit them at home before they join our programme. Often if children are anxious about coming along or they're not sure how it's going to work, I'll go and see them at home. I'll go through the handbook with them. I'll let them so they get to know me and often feel a bit more at ease then to come onto the programme. So just going to go through a few case studies now, some examples of some of the work that we do, the things that we cover and the way we can support families. So here's the Well Guide, and it's a topic that underpins a lot of the work that we do, but it can be really daunting for some families to make changes to diet. And we have children join our programme from 5, but we also then have 18, 19-year-old teenagers can join our programme, and they're at different stages really of perhaps often dietary habits that they've had for many years. And so working together with the family, it's about that gradual approach to make small changes that are going to benefit them as a whole family. And as we mentioned, if we feel that they need additional support, and we find some children come on our programme with very limited diets, a lot of concerns, maybe sensory issues around introducing new foods, then we can either we offer them that additional support within the group or from myself, or if they need it, then our dietitian can get involved and work more one-to-one with the family to offer support with that. As part of our programme, we do our Tier 2 programme, they do cooking within their programme. We're hoping to introduce it into our Tier 3 programme because a lot of families ask for this. But we do also do a snack tasting session, which is often really enlightening to see, because often we'll put out a wide variety of different snack foods for the children to try. And every time I've done it with the families, there's been children that have tried the foods that their parents have said, I've never ever seen them try that. I've never. And we can just offer different ways to explore new foods with their children, and not to ever say no, our child doesn't eat this, won't eat this. So that's a really good opportunity for them to learn together about making those changes to their diet. And as Matt said, siblings come along. So all of our programme is about making healthy lifestyle changes. So even if a child is of a healthy weight, even if a child is underweight, they can still learn through our programme, and we don't focus solely on the weight. So it's about healthy lifestyles that can be for the whole family. So this is a child here, an example. So child A has autism. He eats a limited diet and he's resistant to trying new foods. He eats a lot of meals alone in his bedroom in front of a screen. That's a topic that we do cover, quite often comes up, is about screens. And he snacks a lot on a lot of high salt and fat snacks, particularly when he's low in mood. So this is an example of a child we've had in our programme, but there's lots of children that come in our programme with similar kind of stories. And here we've got a few of the pages from our handbook, which just offer some tips and some of the topics that we would cover when we're thinking about physical and emotional hunger. And as Matt mentioned, we have a family therapist in our team. And if emotional eating is a big concern, or again, we've mentioned here about fussy eating, if there's issues around introducing new foods, then we can give that additional support. But often just opening up these conversations in the group, giving the family chance to kind of see what issues are going on for their child, and starting to see how we can support them and how they can make some changes. So we do mindful eating as part of one of our sessions, and thinking about the food choices that families are making, the reasons perhaps why they might be eating at certain times or in certain patterns. And a big one, which has massively grown, I feel, through since the pandemic, is that kind of isolated eating in front of screens. Often we've had families on our programme say the dining room table has become dad's office. People are still working from home, and just generally across lifestyles have changed for a lot of families over the years, and families are not sitting down and having those meals together. And so it's trying to unpack some of those different things that might influence how, why, when children are eating, and the choices they're making around food. Oh, sorry, I just need to go. Can I go back on here? I don't know if I can, Matt. Can you go back? Yes, I can go. Yeah, there you go. Yeah, I can at the bottom there. Sorry, I couldn't see it. So we support, as part of our handbook, we have a food diary. We encourage the family to recognise triggers that might lead to overeating or choosing less healthy options. And we have the opportunity for the children obviously to join in the physical activity session. We set goals, which can be around screen time, around ways to have a meal together as a family, reducing that screen time, which can lead to overeating. As I mentioned, we have this snack session, which we often find families are introduced to foods they've never tried before. Options just to food labels is one of our topics, and we encourage families to compare. So we'll bring in maybe food labels from 3 or 4 different types of crisps, and comparing the fat, salt, saturated fat content, calorie content in each of those snacks, and maybe just making some of those key changes to some of the foods that they eat regularly can make a really big difference. Identifying the triggers. So often we find particularly some of the older children in our programme really enjoy ways that they can set themselves goals, or find ways in which they can stop and delay and distract, and make those decisions around what they choose to eat. And as I mentioned, we cover mindful eating as well. And that's a session where the children find that really interesting, to suddenly really mindfully eat something, and just really be focused upon the smell and the textures and the taste and how they feel when they eat something, when in our today's society we can so often just be eating on the go, and be rushing our meals, and not be mindful of what we're putting into our bodies. And as I mentioned, that additional support can be offered, particularly where there's very limited diet. And we find particularly with families with children who have autism, that can be really affect how they accept new foods. So we can give that additional support if they need that. So this is a slide we often share in our groups, which is just comparing a high density and a low density food for the day, basically. And families are often, or will often talk about, meals such as having a fast food meal and then feeling hungry afterwards, and often talk about their children when they try and reduce portion size, that suddenly their children are hungry all the time. So what we really try and build up is just the importance of the variety of foods that we can eat within the Eat Well guide, and just how actually that a child should never feel hungry if they're eating that full balance of all the different food groups, and getting all the different nutrients that they need. And energy balance is one of the sessions that we do. And this fact, did you know it only takes 100 extra calories per day to gain 10 pounds over the course of a year? And we'll often get families say, I can't understand why they keep putting on weight. And it's just going back to that energy balance and thinking through what they've done during the week, and perhaps what they've been eating, and the physical activity levels. And we have ways to track their physical activity through step counters, through recording what they do. And as Matt mentioned, we have those questionnaires that we do at week 1 and we do again at week 12, and try and compare what's new activities they've introduced into their week, and what new activities they're doing regularly, if that's just walking to school or parking a little further away and walking, just any ways in which they can increase their physical activity, and make those small changes to their diet. It all makes a difference. So another example here of our physical activity support. So we think about all the positive things that can come for our mind and for our body from being physically active. And we've all gotten very used to, haven't we, our sedentary lifestyles of driving places, of being on computers. We're all sat here now on our laptops, and life over the last few years has become more sedentary in some ways. But we all know those benefits of being active, of getting outside, and we just really try and encourage that. And every child, whatever, however they come to this, so we get children who say, I hate sport, I hate this, we'll find something. We can always adapt how we do it and find some fun ways in which they can be active. We do a session where we do activities around the home, which the parents always love, because we talked about how they can, help with the dusting, help hanging the washing out, help with the hoovering, and we get out brushes and dustbin and brushes and mops and things, and get the children involved in that. And just that being active around the home, and just all add to us, to our well-being, really. Oh, I'm sorry, I keep flicking too fast on here. Here we go. So this is another example. Child B eats a healthily balanced diet. So we have children come on our programme and they'll say, well, look at the Eat Well guide. They eat a really healthy, balanced diet. They'll show us their food diaries and say, this is what they eat, but why are they're putting on weight, or we're really struggling to know what to do. So Child B eats a healthy, balanced diet, but drinks very little water. And again, that's another topic we cover, is about the importance of water. And they drink lots of sugary drinks. She enjoys playing computer games and interacting with her friends on social media. She has hypermobility and sits out of most of PE lessons in school. And her parents do not enjoy sport, and the family spend a lot of their weekends doing sedentary activities. So again, some of the things that we'll cover within our physical activity session, we'll cover non-exercise activities and neat activities, ways that you can be active without actually doing sport as such, and just offer lots of different suggestions of things that that children and their families can do to be active. We cover the importance of water and hydration. We do a session on sugar in drinks, and a lot of families find it really surprising. We cover different drinks and the number of teaspoons of sugar in each drink, and they don't realise just how much additional calories that they're consuming, or their child's consuming, in what they drink each day. So yeah, as I mentioned, we cover lots of tips and ideas, and we have promotional offers. And when children reach the end of our programme, we can offer them offers such as a month's membership to something, or we can give suggestions and ideas of what's available in their local area. We'll get parents say, my child would be really interested in doing this, and our physical activity coordinator can often offer suggestions of how they can get involved in those activities. So we also have the sessions where the family will get involved together. I love these sessions where it often takes some of the parents outside their comfort zone, or carers, when we say come and get involved. We remind them to put their trainers on that week, but actually just seeing that interaction between the parents and the children as they get involved with the sport. We make it really fun, and we do ideas that they can easily do at home in a small space, but also ideas for wider sports that they can do together. And we often find families say, oh, really enjoyed that, and that was really good for us together as a family. And we can provide that additional support if a child needs that additional support with new exercises and things. And Zach can go out and do one-to-one sessions at home with a child, and work with the family to see how we can increase their physical activity each week. As I mentioned, we cover the sugar and content in drinks, and if a child's drinking 5 cans of Coke a day, we're not going to say nope, stop. It's all about setting those SMART goals. It's just slowly reducing, slowly making those changes. It's suggesting things that you can do instead. We've had children that maybe are used to a sugary drink, and switching that for like a fizzy drink. Then we might say encouraging squash, sugar-free squash with sparkling water, and different ways in which they can slowly make those changes, so they're not just suddenly making a massive change to their diet suddenly. So we discussed the screen time and the impact that has on weight and sleep and physical activity. So again, it's just those slow changes as how we can set goals. We often find that the parents have quite a discussion around this. We get some parents who are very strict maybe on screen time, and other families that don't set any limits for their child, and it often brings up quite a few parenting conversations around ways to make those changes, and that can be really hard for some of the parents. And I'm a parent myself, and I think that helps sometimes that we can have being realistic about this. We're not going to suddenly make overnight these changes, and the real challenges that there are to the lifestyle that we live these days, and all the barriers there can be. And when it comes to screens, I've got 2 children at high school, and all their homework's on screens, and that can be really hard just to try and reduce that and see how that can impact their weight and their eating and their habits, but just to slowly make those changes to the family over time. We've got a few questions coming up on the chat. We will cover the questions at the end, so we're not going to miss those. Those that are putting those questions in, that's brilliant, that's really helpful, and we'll go through all of that at the end. So attendance, we require families to engage in our regular sessions to get the most of our programme. And if they miss 3 or more of the initial 12-week programme, then except in exceptional circumstances, then they do have to join a new programme. They have to go back on the waiting list. We'd obviously update the referrer if that's the case. If there are exceptional circumstances, we will offer catch-up sessions. Sometimes we offer for families to come half an hour early to a session to catch up on what they've missed out, or I'll give them a call during the week if they're not able to attend. So if families aren't in a position to commit to the regular sessions, or that they're not perhaps in that place where they can join, then we can support them, as Matt said at the start, with our Tier 1 online resources. So if families are on a waiting list, then I'll send that all out to them in an email, and also signpost to other helpful websites and things where they can get support. Sometimes families will ask me specific questions. Can you just give me some advice around this? And that's fine. And also, I'm always happy to work with other professionals around the family. So, if you need some advice, if you're working regularly with the family around how to approach some of these questions with the family, or suggestions perhaps around how they might make those changes, really important that we all work together so that the families are getting the same message, and that they're not confused around what suggestions are being made to them. So if families don't want to, it's up to the families whether they want to engage in our support. And if they don't want to remain on our programme, we, as I said, we always ask for feedback from them. If there's any ways we can change it, if there's barriers for them joining, we'll try and adapt to see how we can best support that family. But if they say this really isn't for us right now, there's other things going on in our lives, or actually we feel we've got what we need and we're happy to just carry on as we're doing at home, we'll always update the referrer, social worker if they're involved, but that's the situation if families don't want to engage with our support. If weight management is a concern to be addressed as part of a child protection plan, then again we can discuss how we can adapt the delivery of our service, but we also we often find that children sometimes will come on our programme but they're not then able to make those changes at home, and maybe are not following through some of the advice we're saying. So we'll work with other professionals around the family to see how we can best support them. So yeah, and as Matt mentioned, we can sometimes signpost to other services first if we think perhaps in addressing something else first might be more beneficial to the family, and then perhaps to join our programme later down the line. So engagement issues, just going to go through a couple of quick case studies here. So this is a child that we offered one-to-one support for, a 15-year-old. Initially, they were attending weekly sessions at home and they were engaging. And then they decided they didn't want to attend a session and went out with their friends after school. And then the mum discussed with the child if they still wanted the weight management support, and they said they did, and then cancelled 2 further home visits. And then decided that they no longer wanted that support. So this was fed back to the social worker and discussed with them. And this is something I think it can be really difficult. We're working with some of the younger children. We're working much more with the parents. When it comes to 15-year-olds, it's much harder. We're not there to force a child to attend at all. We can adapt how we deliver our programme, but equally we respect their wishes. If they've got other things going on in their life, then we can be there for them. We can give them our information and say, come back to us if you need support in the future. Another child here. So as I mentioned, the child is on a child protection plan, has a BMI of 39, and her paediatricians confirmed that there's no genetic or medical reason for her BMI. And we do have children on our programmes that have had inpatient stay to confirm this, that they're able to, in an in-hospital stay, provided with a healthy diet and regular exercise, that they are able to lose that weight. And part of the plan for this child includes compulsory attendance to our programme. And this is something we often find that if the family do attend, then that's great, but we also need that family to be able to make those changes at home and be setting those goals. And we'll work with those other professionals around the family that with this situation, there's concerns that the food diaries are not a true reflection of what they're eating, and also that they're not making the changes to increase physical activity for the child. So, yep, as I mentioned, we can offer that additional support, but we are commissioned to deliver our core programme. So we do need families to attend the core programme, even if we're offering that additional support. So we'll sometimes get families say, I'm coming on this programme because I want to see the dietitian, or because I want to have sort of one-to-one support from the physical activity coordinator, but we are commissioned to deliver the programme as a whole, and then that additional support on top of it. And attending our programme will not help aid weight loss. That we need the families to really be making those changes at home, and we'll support them in every way we can to make those changes. But it's all about the best way we can set those SMART goals and support the family in making those changes. And our family therapists can work with the family if there's barriers or resistance to making changes. So that is an additional way we can offer support. So a few positive changes here, just some quotes here for some parents. So a parent who found learning about the portion sizes through practical activities. So often find, particularly some of the younger children, doing things practically, they take that away. They love, or we've had children who love get the food scanner around reading the food labels. They love doing that. We've had parents say they've emptied the cupboard when they've got back home and scanned every food in the cupboard to find out what's in their food and make some of those healthy swaps to what they're eating regularly. So that's brilliant. brilliant. As I mentioned before, the food snacks, it's just so rewarding when you see children try foods and parents say they've never tried that before, or come back the following week and telling us about things that they've tried that they've introduced, which has been really good. And had a child really positive when he was losing weight, and his paediatrician praised him, and he's had so much more energy when doing sports. And it's really positive when the children can see those positive changes for themselves. So we really do not focus just on the weight themselves. It's about feeling better in themselves. It's about being able to be more active than they've been in the past, and being able to do things that they haven't been able to do in the past. As I mentioned earlier, one parent fed back, and a lot of parents really enjoy the sports sessions that they do all together, and that can really help them then go out and say, look, we're going to do this, let's do this at the weekend, let's set a goal to after school, let's go out on our scooters, let's go to the park, let's get involved in things together as a family. And then a parent that found it hard introducing new foods, and the additional support from the dietitian has helped to start trying to make changes. And also for that parent, having the group sessions, having other parents in similar situations has really helped them to feel supported and know that they're not on their own. So this is something which you might all have some questions on when we come to the question question and answer bit. So those discussions that we have with the child about their weight, as Matt mentioned, we have that additional support and training when it comes to, I don't make those NCMP calls, but we had some really good training recently for the practitioners that do make those calls, and some of them have had some really tricky phone calls to make. So just a few tips here, and any other questions, please, bring those up at the end. So really important to focus on the changes to a healthier lifestyle, not just on the child's weight or size. We can sometimes find either professionals referring in or the families themselves becoming very fixated on the weight. And when we do weigh in the group, I'll take them into another room, and we don't share that with any other families in the room. And if we need to offer additional support, we'll do that outside of the main session so that the child doesn't feel concerned or worried about that within the session. So use of the language that we use, important to talk about that they have a higher body weight than is healthy, rather than the terms such as obese or fat or overweight. I had a child come to me the other day and said, am I obese? And was quite upset about that. And just really important to focus on how the child can make changes and not see it in a negative light, and to just really build on their confidence. So another point of focusing on their self-confidence and celebrating the positive things that they can do. We try and just be really positive around there, what they're able to do, how they join in, and the things that they do achieve. And we really encourage them. So when they do lose weight or when they share with us changes that they've made, we're just really positive about that, and that really encourages them. So as I said previously, encouraging that whole family approach, and support around others being a positive role model. And I think that can be one of the biggest challenges, can be particularly if the parents or other children, the wider family, if they are also overweight or have weight concerns, then that can be really difficult to discuss that. And we respect the families, and we don't discuss that within the sessions as such that they don't feel we're singling them out or mentioning that, but it can be really helpful if we're offering that additional support to encourage the whole family to do it. Last week I had a program, and Mum Art said, can you print me out some sheets? So within the handbook we have the sheet where they record their weights each week, and Mum and Dad were both wanted to come, and I said that's fine, you can use our scales, use our height measure, and they're going to do their weights and heights each week as well, to work with the child. So they're going to have a separate sheet to record theirs on privately. They can do it themselves, but then it just really helps to support the child. And as I say, don't focus on the number on the scales, and so focusing on some of the positive changes that the child can see, like increased energy levels, reaching targets that they set themselves, making changes to some of the food choices that they have. And then identifying areas that might influence. So we have a topic about emotional eating, and it just can be really helpful actually to focus on why those situational times, or whether that child needs some more emotional support, whether they're emotionally eating. So to work on that rather than making it a negative about the food choices that they're making, because food can be as a comfort to that child, and we don't want to take that away, but we want to identify other ways in which the child can have that comfort. And then allow the child to have chance to talk about how they feel about their weight and their body. So I can do that as a one-to-one, or we just allow the children, if they want to talk about things, then not to but not that they don't have to talk about it, but if they do want to come and talk to us separately, when we do review sessions, when we discuss about their progress, we'll use the 3 houses and focus on perhaps their hopes and dreams in the future. Have children who maybe want to get involved in a sport, have dreams of a certain job in the future, and or just have changes that they want to see in their life down the line. So we set short-term, medium-term and long-term goals at the start, and just helping them to look back at those goals and the steps that we can go through and we can support them in to reach those goals, can really just help them stay on track, and just help them focus on where they can be with our support. So as Matt mentioned, we're going to share this presentation with you, and these are all our contact details. So this is all our contact information here. So do get in touch if you've got any. We're obviously going to have time after the Rachel's session in a moment. We are going to have time for questions and answers. But if there's anything you think of afterwards, or if you have a particular client you want to discuss with us, then these are our contact details. So please do get in touch. I'll just hand back to you, Matt. Is that right?
Yeah, no problems. I think I stop sharing. There we go. Brilliant. Thanks, Sarah. So yeah, over to you, Rachel. I don't know if you're in the meeting.
Yes, I am. Yeah, sorry, I won't share my videos because I live in a village and my internet connection is absolutely rubbish. I end up looking like I'm like in some kind of Russian interrogation. So I will just speak if that's all right. And I haven't got any slides because I'll just speak for kind of 10 minutes about when weight management becomes a safeguarding issue. And my dog is doing zoomies around the room as well, so she might join in. Weight management quite often gets asked about in terms of when it becomes a safeguarding issue, because it's something that we can see very readily in terms of health. And so we get asked about it in terms of safeguarding a lot, because it's very visible when a child is visibly larger. You know, we can't see when teenagers are smoking, we can't see when they're, you know, taking drugs. So we don't get asked about those things when they're impacting their health in other ways, but we do get asked about weight management a lot. And our Royal College guidelines are very clear that weight in and of itself, or being obese or having a diagnosis of obesity, for lack of a better term, is not a safeguarding issue of itself. It's very clear in our Royal College guidelines. The time that it does cross over into being a safeguarding issue is when it is impacting a child's health. So when the weight is of a significant, when it's a significant issue that it's impacting a child's health, and the family is not engaging with weight management issues in a meaningful manner. That is a really difficult way of measuring anything. So when a child is young, it's relatively easy to manage that, as everybody's discussed before, because family kind of control what a child is putting into their body and eating and all the rest of it. So that's a relatively easy thing to kind of control when a child is kind of before secondary school age, in my kind of cutoff. So before secondary school age, if a child is of a higher body weight, then we can kind of take more aggressive measures in terms of management, and safeguarding is a bit more robust around body weight. But there's a lot of disguised compliance that goes on, and actually getting a handle on disguised compliance is really, really tricky. And I don't think that a lot of the disguised compliance is deliberate disguised compliance. Lots of families are very, very clearly wanting to do the right thing, but often just not quite getting there. And then by the time the young person gets to being in secondary school age, we've very much missed the boat, because they have their own views, they have their own peer group, they have their own influences, and then we've kind of missed the boat in terms of being able to get them on board. And trying to influence a teenager is incredibly difficult. And yeah, it's going to be hard to get them to any stage at which they actually want to engage with change in a meaningful manner. And then, yeah, we can't really call it a safeguarding issue if the parents are really wanting, or the family are really wanting to help and engage with a change, and we can't force a teenager to engage with a program which will actually be harmful to them if we're saying, you know, you must do this against their will. That would then be abusive towards them. So it's a really difficult balance, and it's not something that we get right a lot of the time. I'm not saying that anybody is doing anything wrong, but you know, it's just a really tricky balance from a safeguarding point of view, in terms of how do we get this right. It's something that we need to do kind of proactively whilst children are young. If we're seeing things kind of going the wrong way whilst children are young, getting in there early, because as soon as they get to teenage years, we've missed the boat from a safeguarding point of view. Yeah, wait, the main takeaway message is weight in and of itself is not a safeguarding issue. It's what everybody else does around it. It's a holistic issue. There are usually neglect issues around weight. It's the other issues that all feed into it, and what everybody else is doing around this young person that feed into their weight issues, and how everybody else is responding to their weight, and how the family is interacting with professionals, health professionals, weight management issues, and how we can best help in responding to it. Sorry, it's not a nice, easy answer. There isn't ever a nice, easy answer, but yeah.
Brilliant, thank you, Rachel. Yeah, you're completely right, and one of the main things behind that is all the services working together, isn't it? Working collaboratively around the family, and that's something we really do try to promote. And you know, our staff, particularly Sarah and other roles, do really work hard to collaborate with those other professionals around the family, and if we're all sort of pulling the same way, it gives the family the best chance. So no, that's really interesting. Thank you for that.
Yeah, and I
So
think just to add,
sorry,
when
sorry.
it comes to, I was just going to say, when it comes to the teenagers, I think, you know, you're totally right, Rachel, that that we have missed the boat to some extent, but we do have teenagers join our programme willingly, that do want to learn, and we have seen they want to make those positive changes, but as you say, it's the parents no longer have that control over them in the same way, and it is much more about that child themselves wanting that support, and as working with them as much as primarily working with the teenager themselves to support them in making those changes. So should we go through the questions that we've got in the chat here first, Matt, and then if we've got any further questions, if they want to put their hand up, then we can go through those.
Yeah, sounds good. I think yeah, that first one is probably something I missed off about the tier 3 support in the Waveney area. So yeah, our tier 3 service covers East and West Suffolk, so that doesn't extend to Waveney. They do have the James Paget Hospital tier 3 weight management service based there. So we will signpost any Waveney-based clients that are more suitable for tier 3 support. We will signpost those to the James Paget Hospital. They do have I believe there's a form, isn't there, Sarah, a simple referral form, but similar to the way you refer to us, that you can refer through to their professionals, and they offer a slightly different service to us within tier 3, possibly more sort of clinically based. But yeah, that's where you'd signpost them to. If we do have clients in Waveney that actually, you know, might be suitable for our tier 2 program, then we will obviously book them onto our tier 2 program in Waveney.
And if we have clients that attend our tier 2 program in Waveney and we feel that they need that additional tier 3 support, then we can refer on, or I can always refer on at triage to the James Paget Hospital, the nurse that works there. So we will liaise between the two, but often GPs will refer straight to the James Paget if they feel that they need that support immediately. So yeah.
Brilliant. Someone's asked about support for under 5s. So we don't offer support for under 5s. However, we work closely with the Henry program within Suffolk. Excuse me. So the Henry program offers a similar program to what we offer, healthy lifestyle support. There isn't actually eligibility criteria for that program, so it is just open for parents of children under the age of 5 that are just requiring a bit more support around healthy lifestyles. You can refer into the Henry program through your local family hub. So you can give them a call or go into the hub and they will take referrals through there. Or alternatively, if you go to their website, and as I say, it's a very similar service to what we offer, but it is external to us. Sorry, bit of a frog in my throat. Next question was supporting children with eating disorders. So we do, Faye, I don't know if as dietitian, if you want to give us a talk around that.
I mean, I guess it depends on kind of what you're sort of referring to. I mean, some of the children, I think we already have kind of what you'd sort of maybe say some sort of level of disordered eating, mostly around sort of emotional. We have a lot of emotional eating, but again, what we would do is look at the child and when necessary, then refer them on to the mental health trust. So, and that would be dealt with there. But the trouble is, as often we know, there's sort of such a lack of services. So the threshold might be quite high to get them in. So it's worth probably giving us a call and having a chat with Sarah as the triage nurse or myself, and just to sort of see sort of how, you know, what that issue is. Obviously, we don't work with beyond that remit, but it's worth kind of us knowing, you know, if you're experiencing work, you know, if you've got clients that you think need that support, it's worth having that discussion with us. And I think we've got Michael on the call here as well, who commissions the service. So it's about feeding sort of that information back up to commissioners, so we know that, you know, if there are gaps in service, we can try to sort of fill them.
Thank you, Faye. Wendy has asked where the group sessions are held. So we try and base those all across Suffolk. So within tier 2, we tend to run a group in the west. We do try to get out to sort of the more rural areas, but for sort of for viability of the groups and to ensure that it's accessible for as many people as possible, in the west it will tend to be sort of Bury area based, sometimes sort of surrounding areas of Bury. Within the east, it tends to be sort of more central Ipswich, but we do extend out to sort of Felixstowe area and Woodbridge area. With Waveney, it will tend to be sort of Lowestoft based. So it does cover all of the areas of Suffolk. As we say, within tier 3, we can offer delivery on a one-to-one basis as well. And one level of sort of criteria for that might be for clients that are sort of based a bit further away from where we tend to deliver. They may also have sort of issues around travel and accessibility. So we take that into account when we bring them onto the program. But yeah, we'll tend to at least have one group session within each area of Suffolk.
And within tier 3, obviously we don't get quite as many referrals, so we do work that out each time. So as we build up a waiting list of clients, we will look at where we're going to start our new groups. As we mentioned, we run them in the evening, so they usually run up between 5 and 6:30. And so finding, obviously, when we run the groups, we then have other groups on fortnightly sessions and other groups on monthly sessions. So we have to coordinate which day of the week we can fit that in. But we will see. So we run the Zoom groups, as Matt said. So we run those to sometimes to pick up the clients that maybe live out in Haverhill or have got transport issues, so that they can still access our service. And we have families on our Zoom program that, in addition to, so we'll cover all the same topics but do it via Zoom. And then sometimes I will go out and offer additional support at home, go and visit the client at home, maybe every few months, to offer additional support in the same way those children would be discussed at MDT meeting. So if additional support from dietitian, family therapist, physical activity coordinator or myself, then we can offer that in addition. So we do offer that way of ensuring that maybe those that can't travel in can access it still. We obviously need to find venues as well. So each time we'll look into where we could run it and what would be suitable to run our programme, and try and make it somewhere that there's parking and that there's area that they can join in the sports session. So yeah, that does vary each time, so it's not the same places.
Thanks, Sarah. Did you want to talk about Sam's question as well? Because I believe
Yes.
we've obviously had children in this situation in the past. So what happens when there are younger children and they've attended programs multiple times? So we will, Sarah touched on the presentation, we will have children that go through the program and there's not necessarily a problem with their engagement. They will engage with the subjects and stuff, but you know, the weight only increases. So we do signpost to other areas, don't we, Sarah?
Yeah, so it would be identifying what are those concerns really. I think so. If a child, say, has gone through our Tier 2 programme and continues to gain weight, then they would be referred up to our Tier 3 programme to offer more intensive support. During that time, we would identify what the main areas of concern are, whether it is around diet. So within those, we'd have that opportunity to give that more specific support around it. So main issue is weight. What happens next? Well, we, again, as we say, we can offer to them to rejoin a program. So if a family's been through our year-long program and they continue to gain weight, then they can reattend a new program, and we can offer more additional input from each of our specialists if that's needed. I guess I don't know whether, Sam, whether you're discussing that as a safeguarding concern. We do have families that are on child protection plans because of weight, and in that sense, we would feed that back to social workers, other professionals working around the family. And as I mentioned, we have had children that have been admitted by paediatricians to the hospital, firstly to identify if there's any underlying medical conditions that might be causing the weight gain. And as Matt mentioned, we'd always we want that medical referral into us. So we always, GPs, we ask them to screen for any comorbidities, and we would work with them if we've got concerns. We think there might be some medical concern as to why they're gaining weight, then we would get that looked into. But if there's no medical reason why they continue to gain weight, if, as I say, if they're on a safeguarding plan, then that would be discussed with social care and others working with the family. I don't know if you want to add anything more to that, Sam. Put your mic.
Yeah, so I think we've got, I think, numerous children in our team. Like, I'm a child protection team, and we get to the point where they have attended kind of multiple, I think it's even Tier 3 service, and we get to the point where we've got a child on a child protection plan for nearly 4 years, and it is purely because of weight, and we can't get them off of the child protection plan because there's still significant concerns about their health, for example, like sleep apnea or other like weight related issues. So we find ourselves very stuck in that we cannot get this child off a child protection plan, but we can't say anything's got any better. And I think it's these situations where we are really stuck in what to do, because we have to then make a decision: are we going to enter into care proceedings because a child is obese? And ultimately it's not really in the best interest of a child to do that. But then where do we go from there? And it gets to the point where families are saying, well, we've done the course 4 times now, we're not going to do it again because actually there's no impact. So that's just, I think, the times that we're really stuck as well. And I just didn't know if there's any kind of advice of where we go from there.
I think, can I just jump in here, Sarah? I think let Sarah go. But yeah, this is something, again, Sam, I think we've worked together with you before. This is a sort of an issue that we do see, and it is really difficult, I think, from your end and ours as well. And obviously they can if they come onto the course, again, they may engage by coming, because often it's part of the child protection plan, but actually it's then making the changes that may not happen. So it's not that the course is ineffective, it's actually that they're not making the change for whatever reason that is. And we do find ourselves stuck. We've got a couple of cases at the moment, haven't we, Sarah, that are in mind that are exactly what you're describing.
That's the
and it is
none of us can monitor what they actually eat at home. They can, and a lot of these families can tell us, oh, we're doing this, we're doing that, we're following the plan, but we've got no way of actually knowing, have we? And that's the hardest part for us.
I think it's really important that I mean, I guess for a lot of these families, there's so many other things going on that actually weight is although it might be part of the plan and the reason that they're on the plan, it may not be that they have the capacity to do anything about that right now. And again, I think policing doesn't always sort of work. If they think we're kind of looking in their bins and reading food diaries, it's kind of sometimes it goes against us. So I mean, we don't have an answer, do we? I guess at the minute it's just trying to work with them. But again, at the start, when you're making referrals into service, I think it's really important to have conversations with families about what the service is, because quite often I think they come to service and they don't realise that how much input is needed, or how much they need to attend. It's weekly, it's for a year, and what the expectations of the service are, and we find that quite a bit. But yeah, Sam, I don't have an answer. It's something that we struggle with as well.
Just find it's becoming more, yeah, it's becoming more and more now in our teams, and I just don't think we quite know the way forward yet either.
And I think it comes back to what Rachel said. It's that disguised compliance, isn't it? And how we deal with that. I think we need to just have really open and honest conversations with the families, because it's not, we know that if they put the behaviours into practice, it would work. And it's just us really working closely together and communicating beyond the core meetings and the child protection conferences, to make sure that we're on the same page as professionals, I think, and we give like a united sort of voice to the families, so we're not played off against each other, which I think can happen.
And I think that can be hard as well, making those decisions as professionals about where we go next. And we have had children on our programmes that have been told, if you don't lose weight by the next conference, then child's going to be taken away. And we've had children quite, upset and concerned about that, and they perhaps have lost weight, and therefore that has not gone ahead. But then they, like you say, they then continue to put on weight after that, and it's just really just difficult, isn't it, Faye, to make those decisions. And I think, again, working as professionals together, so the families aren't getting those mixed messages, or trying to get that disguised compliance around making those changes as well.
Yeah, we've got a hand up. Michelle, did you have any comments on that?
Yeah, I did. I'm Michelle Stafer. I'm County Safeguarding Manager for Children and Young People Services. So we manage the child protection thresholds. I've recently chaired a stop and review for 8Ks. I think some of you would have been at it. Sam is certainly aware. I think from a strategic perspective, this is something we're looking to move forward on quite significantly, because we have, as Sam says, across the county, an increasing number of children who are becoming subject to child protection plans because of the weight situation. And then obviously child protection plans aren't moving. And then, as Sam said, we're in a situation where legal advice is, well, we can't really remove a child because of weight issues, except the reality is if the child stays in that situation, the chances are, if there's no change, this child could possibly be so significantly impacted on by the compromise, by the subsequent effect on their health, that we may end up with a fatality. And certainly we couldn't argue they're not at risk of significant harm. I think one of the things I've picked up from today is I kind of what we've said. It's not actually so much the weight issue, it's what everyone else does around that young person or child, which impacts further on the issue. And I think from our perspective, Sam, certainly from a legal perspective, that's what we need to be looking at, because, these children aren't living in isolation. I do totally accept what we're saying about teenagers and their own challenges, but actually we still have parents around them with parental responsibility who we're kind of holding to account for things not moving forward. And I think for me, one of the things I've picked up, and that's why I came today to look at this, because it's becoming an increasing issue, it's actually that meaningful engagement. and what else can we do to join up those gaps. So like we say, it's about trying to get the parents to engage in with OneLife, with the young people in whatever way we can, but then what can we do to see what's happening in the home, because that's obviously once they go home it all falls apart. And so it is a challenge, but it's something we're looking to prioritise across safeguarding with colleagues. So I think Sarah, Faye, Matthew, Jackie and Rachel, it's something we're going to be kind of asking you to work with us on from a strategic perspective, because we have shed loads in store for children at the other end of the spectrum with eating disorders, for anorexia, bulimia and all of that sort of stuff, because obviously it's linked very much in with mental health. But this is a huge void for us, and we need to kind of, it's just increasing and increasing. And as Sam said, we keep getting in a stuck position. So there's lots of work to do, but we are going to be calling on you from a strategic perspective to help us move forward, and probably with our legal forums as well.
That's really good news, Michelle, because that's kind of one of the reasons we felt like something like this was really needed and the conversation was started, because we felt like we were coming up against this.
So now we've got your details, I'm afraid. We're not going to let you go, but we've got to develop it, because there's so many nuances, and like, you know, the social work teams are being squeezed, the child protection chairs are being squeezed, and it's just really difficult. So it's something that we need to do from a strategic perspective. It's obviously our next way forward.
Brilliant.
So thank you for today.
That's great. Thanks, Michelle. Just going to go through, just mindful of time, to go through some more of these questions that we've got on here. Laura's asked about any latest research around identified children as obese around BMI. Obviously, I think there's a wider discussion around that, isn't there? At the moment, we do have BMI as the sort of leading criteria into our programme. And obviously that links into National Child Measurement Programme measurements as well. I think
BMI it's still the tool that is used to identify children's, you know, eligibility criteria. We don't use waist circumference and things like that within children. That's for adults. So it's BMI centile, which is different to BMI for adults. It's plotted on a different chart. So if you're unsure, there's a tool on the NHS website that you can actually sort of, that would give you an idea of what a child is if you have weights. That's the sort of best way to do it.
Okay. Rebecca's asked about services for under 5, so covered that with the Henry programme. So it's worth a look online at Henry programme if you are working with under 5s. As I say, their services are similar to what we offer. When they do reach the age of 5, they then are eligible for our programmes and can be moved on to ours with obviously their family. Where can we find the form to refer to James Paget Hospital? We can share that. I think we have got the form, haven't we, Sarah, that we can potentially pass on?
We can pass that form on, or also just via their website. They've got a page which has the contact details. So they're the nurse that works there, similar to me. She's always happy for people just to give her a call to discuss clients. And then I believe her email address is also on the website. I can check that out. But she just normally says to us, just complete the form and we can send it on to her. So I think she tends to send it out in response to those discussions. It might work. I think it probably works differently from the GPs, and she mainly gets referrals via GPs, which probably do it via their own online service platforms of how they do that. Yeah.
Okay. Kerry's asked about the long-term statistics. So this did come up last time we had a similar thing. So I'm happy to share some stats. We are working on a bit of an infographic at the moment just to show our statistics from our program over previous years and sort of the rates of referral in and then how many make it through the program. We do sometimes have trouble keeping people on the program and keeping them engaged and keeping them across that 12 months. We are trying to improve sort of the dropout rates, but obviously there's there's various reasons as to why families do drop out of the program. But yeah, I'm more than happy to share those with you just to give you an idea as to you know, how successful we are with those families. But we also feel, you know, some families may drop out throughout the program for various reasons, changing circumstances and that. But you know, if we've been able to have that initial that especially that intensive phase of the program, if we've been able to engage with them through that program, we still feel we've had an effect on them. But obviously, ideally, we do keep them across the 12 months.
I think the results at the minute look similar to kind of other programs, and it's the same with kind of adult services, that we know it's quite hard to sustain weight loss. To the further in time you go, it might be achievable initially, and then it's hard to sustain it, and that's something across all weight management programs. But yeah, we're looking at collecting data. We have to collect data for our KPIs, so we have that, and we're able to share it.
Yeah, and that links on nicely to Natalie's question. So yeah, we do weigh the children at every weekly session. So we do keep a sort of track of their progress via the weight and height that we take each week. Obviously, we bear in mind that children are growing whilst on the programme as well, so taking that into account as well.
So just in addition to that, that question, if that is an issue, so we have had families say to us that children are perhaps concerned knowing that they're going to be weighed each week. We've had children say they won't drink before they come to the session, or they'll wait and eat after the session. And we really try and encourage the parents not to be really focused on that number. We've had children that weigh themselves the day before they come and things like that. And we don't want that to be a barrier or to be the focus for the children. So we have had children that I've said, look, should we just weigh? So from KPI collecting data point of view, we need to weigh them at week 1 and we need to weigh them at week 12, so we can see the impact across that time. Families on child protection plans, often I will need to update social workers weekly sometimes when they're on that programme, but we don't want that to be a barrier. So we're happy, if the child's really upset about it, we won't weigh them, or we ask families so they can attend early or stay behind at the end of the session, but we'll always do that as a one-to-one in a room outside of the main room, and there's always an opportunity for the child or their parents to have a discussion one-to-one about it if they've got concerns. And we always just really try and encourage the children as well, so that we don't focus on it as them being upset if they have gained a small amount of weight that week. We focus on what positive changes they might have made. Often there's situations like they'll say, oh, I know this happened at the weekend, I did this, and we just try and encourage the families as well not to focus on it being naughty or bad to eat certain foods or to do certain things, because we want the sustainable changes. We don't want to make things off limits or to feel those children cut out from it. So yeah.
Brilliant, thanks, Sarah. Clara's asked about programs in the Sudbury area. We have delivered in the Sudbury area in the past. It is tricky, and we do get clusters of clients sort of popping up in certain areas. With our group delivery, we do have to sort of balance it with obviously the capacity of our staff to go out and deliver in certain areas. But if there are sufficient numbers within an area that can attend a group, then we will put on a group in that area. We do have our sort of waiting list, which we regularly reviewing, and if it does get to the point where we have enough to deliver a group, we will do that, but we will stay in constant contact with those families. We appreciate it isn't ideal, and we do get families in quite sort of rural areas within Suffolk that can't travel to groups. We can't viably put on a group out there for them, and it's a bit of a grey area, and it's not too much we can do. That is being looked into, and we are looking into sort of travel arrangements as well for families that may not be able to travel in. But yeah, if you said sort of you've got 4 there, and really 4 or 5 we'd probably look at as being a sufficient number to then put on a group. So if that is the case, then we can look at putting on a group, and I will make a note of it, and just to take a look at what we have got in the Sudbury area. But as I say, we do constantly keep track of our numbers, and once we do hit a certain threshold, we then are able to put on groups.
Yeah, and as we mentioned as well, we do the Zoom program. So as I say, if we can offer that, and we can offer home visits on top of that. So if that can sometimes be a second best thing if a family do want to access our program, so they can join that.
Brilliant. And yeah, just a couple of comments off Inga just about behaviour change, and yeah, completely agree that I sort of touched on earlier that within our sessions we really do try to sort of facilitate the families making these decisions, making these changes themselves. We understand that simply by bombarding the families with information about healthy lifestyles isn't effective, and the behaviour change does have to come from within. Our teams have sort of coaching skills and mentoring skills that mean that it can hopefully effectively facilitate a session where those families can make those decisions themselves, come to realizations themselves, and have a good awareness themselves of what they're putting in their bodies, the activity that they're doing, how they're living their lifestyle. So that is really important for us. Michelle?
Yeah, I was just going to say, Inga, what I've done is I've just sent an email from a strategic perspective, because I'm not so sure this shouldn't be linked in with our graded care profiles and neglect strategy. So I've just sent you something so that we can look at how we develop a strategy that brings us all together. Hopefully she heard that. If not, she'll pick up my email. Thank you. It's been really informative. Thank you, guys.
Thank you, Michelle. I do have it.
Has anyone got?
We'll talk, Inga. Thank you.
We've got a hand up from
Yeah,
Laura.
we've got a hand up. I'm just trying to look down as well. If anyone's got any questions that we've not answered yet, if you do just put your hands up and jump in, then we'll make sure they're not missed. I understand. I appreciate that some of you have had to leave, and that's fine. Yeah. So Laura, do you want to ask your question?
Yeah, sorry if it's already been covered. I was just thinking back to the mention of compulsory inpatient stays to monitor weight loss. I just wondered at what point that would become an option for a child, and how that's really gone about, really.
So that's something that that has come from paediatricians at the hospital, have arranged that. So if a child's under a paediatrician, and so that's when that has come about. And I think that's, as we've had that discussion about the wider safeguarding, you know, if we had children on the other end of the scale with a low BMI, there's the tier 4 inpatient stays for that support around gaining weight, and we don't have that from a from a point of view of weight management from our end, and I think that is an area that we don't, that's not seen as such as a part of our service at the moment, and perhaps that could be something that needs to be looked into in the future. But that's been referral by the paediatricians, arranged that and then manage that within the hospital setting, and then fed that information back as part of the child protection plan, to then prove to the family and to the social care and others around that there's no medical reason that child can't lose weight.
Mm-hmm. Yeah, no, that was quite interesting actually. But they would have to be under a paediatrician already, would they, to kind of meet that criteria to have that hospital stay? Is that right?
I believe so. Yeah.
They would have to be under one of us, and it's a fairly extreme thing. They do have to agree to it. The child does have to be on board with it, and the family do. And it's usually a fairly extreme thing. We don't tend to do it routinely, because it's quite an invasive thing to do, and it's a fairly extreme thing that we do, and it's usually only in the cases where we're trying to establish whether there is a medical diagnosis for the weight gain, so whether they do have something like Prader-Willi syndrome, or any other reason for the weight issues. So it's basically to establish whether there is an underlying medical reason, or to absolutely prove that they can lose weight in a restricted calorie and an exercise kind of strict exercise condition. But the problem is that we do see that families will still kind of sneak in extra snacks and things like that. So we do have to have buy-in from the young person and from the family in order for it to be a useful exercise. Otherwise it's just a waste of a hospital bed and an extremely expensive and quite traumatic experience for the young person as well. So we do have to have buy-in from everybody, and for it to be a useful part of the jigsaw, and for a useful experience for the person. Otherwise it's just another trauma for the young person to go through, and that's not useful for anybody.
No, thank you for clearing that up. That's great. Thanks.
Thank you, guys. So I think that's all the questions that we had in the chat. I hope I haven't missed anyone. Has anyone else got any other questions or comments before we wrap up? And I know we've gone over a little bit, so apologies for that. Okay, I'll take silence as golden. So thank you everyone for attending. Hopefully you have found it informative. we're more than happy to sort of do lots of these presentations with your teams and sort of come on to briefing sessions if that would be useful. And obviously there's lots more we can discuss around these areas, so we're more than happy to set up meetings around that. I've made a note of sort of the bits of information that you'd like shared, so we will share some information around our stats, some information as well around the Henry programme, because there's been a few questions about that, and also about referral to James Paget, and we'll share the presentation with you as well. You've got our contact details there, so please feel free to email myself, Sarah, Faye, or any of the team. But yeah, thank you very much, and I hope you all enjoy your day, and we'll speak to you soon.